Hello and welcome back to 91 Doctor, your trusted source for health tips and medical insights. Today, we're diving into something that can bring relief to millions of people suffering from dry eyes. Carboxymethylcellulose eye drops. Whether you spend hours staring at a screen, deal with allergies, or just feel like your eyes need that extra hydration, this video is for you. Stay with me and let's explore how this simple solution can help soothe your eyes. So, what exactly are carboxymethylcellulose eye drops? These drops are often prescribed to treat dry eye syndrome, which is when your eyes don't produce enough tears or the tears evaporate too quickly. These drops work as artificial tears, keeping your eyes moist and comfortable. But before you run out to buy them, let's learn a little more about how they work and how to use them. Uses carboxymethylcellulose, or CMC, is a type of lubricant used in many over-the-counter eye drops. It's designed to relieve irritation, burning, or discomfort caused by dry eyes. These drops can be especially helpful for people who spend a lot of time in air-conditioned environments or staring at computer screens, which we know can dry out the eyes. They also provide a protective barrier over the surface of your eye, giving them a chance to heal from minor irritations or environmental stress. How to use. Now, how do you use carboxymethylcellulose eye drops correctly? Let me guide you step by step. First, always wash your hands. You don't want to introduce any dirt or bacteria into your eyes. Tilt your head back slightly and gently pull down your lower eyelid to create a small pocket. Hold the dropper above the eye and squeeze 1 or 2 drops into that pocket. Close your eyes for a minute or two to let the drops spread evenly across the surface. That's it. Simple, right? But there are a few precautions you should keep in mind, which I'll cover in just a bit. Side effects. Although carboxymethylcellulose eye drops are generally safe like any medication, they can have side effects. The most common side effects include temporary blurred vision or mild eye irritation right after applying the drops. But don't worry, these effects usually go away on their own. If you experience more severe symptoms like redness, swelling, or persistent pain, you should stop using the drops and consult your doctor immediately. Precautions. Now let's talk about precautions. If you wear contact lenses, make sure to remove them before applying the drops. You should wait at least 15 minutes before putting your lenses back in. Also, avoid touching the dropper tip to any surface, including your eye, to prevent contamination. Dose. The recommended dose is typically 1 or 2 drops in the affected eye 4 to 6 times a day, or as directed by your doctor. The best part is you can use these drops as needed, but if you find yourself using them more than 6 times a day, it's probably best to consult with an eye specialist. And that's everything you need to know about carboxymethylcellulose eye drops. They're a great option for anyone looking to get relief from dry, irritated eyes. If you found this video helpful, please give a thumbs up, and don't forget to subscribe for more health tips and medication guides. Remember, your health is in your hands. Thanks for watching, and I'll see you in the next video. Stay healthy, stay happy. 91. Doctor.